and welcome to Health and Wellbeing on ASO Radio and Television. I am Lois Akbasambu. Health, they say, is wealth, but for children, the right to health is vital because they are vulnerable beings and more at risk to illness and health complications, which are called neonatal diseases. It is very important to minimize the number of neonatal diseases by maintaining the normal state of the child's body and organs. Many parents, however, are not aware of their role in minimizing these diseases. Well, who is in a better position to discuss this than a neonatologist? Our guest today is a pediatrician and consultant neonatologist with the Federal Medical Center, Abuja. Dr. Bessie Ezechiela, you're welcome.
Thank you very much.
And it's nice having you here.
Thank you.
So straight up, when we talk about neonatal disorders, it sounds big, it sounds big. Well, I'd like you to break it down to us. What are neonatal diseases?
Okay, before we talk about neonatal diseases, you first of all want to understand what neonatal period is or who a neonate is. Neonatal period is the first 28 days of birth, okay, from delivery till the 28th day of life. That is the neonatal period. So any problem that occurs in a newborn during this period can be regarded to as neonatal problem, disease, or,
Oh, okay. So what are some of these diseases? Because it seems like there are peculiar or particular diseases that are attributed to these first 28 days.
Neonatal period is a very important period. In Nigeria, neonatal mortality is higher than many parts of the world. Okay, it contributes significantly to under 5 infant mortality and under 5 mortality. Okay, so it's a very important time of life from the time baby is delivered till the 28th day of life. Major contributors to neonatal mortality, morbidity and mortality are neonatal infections, sepsis, prematurity, perinatal asphyxia, what's formerly called birth asphyxia. Okay, these are major contributors and many other problems, congenital anomalies, and so on and so forth. So, but these first 3 are the major contributors to neonatal mortality.
So what are the causes of this?
Well, if you pick them one after the other, number 1 is perinatal asphyxia. Is inability of the baby to transit smoothly from life in mother's womb to outside life. When you have a problem along this period, from 28th week of life, when baby is still in utero, inside mother's womb, till first 7 days of life, any problem that occurs during this period will affect baby's ability to transit to life outside the womb, okay? And it can affect oxygen supply to the brain and lead to a number of other problems. So this is called perinatal asphyxia. All right, so many problems can cause it. Problem when the baby is still in the womb, problem during birth, problem after birth. All right, another one that major contributor to neonatal mortality is prematurity. When a baby is born too soon. Okay, it's a huge problem in our country, and it's becoming increasingly important because of in vitro fertilization. Okay, where many babies are born, multiple gestation, many of them coming out before time. Right? Other problems that can lead to baby being born too soon is like maternal infections, malaria, and things like that. So
if the mom has malaria, it affects the child. So
yes, the baby can be born too soon.
Wow.
Mother's infections in the mother, problems in the mother can affect the baby. Definitely.
Now, what can be done about this? Because basically, when the child is still in the womb, it's a whole different world. And then coming out is almost like a totally different world. So it's not even easy for the mom to try to understand how to take care of this child. Now, what role can the parents play in trying to, see that this child is able to successfully transit from being in the womb and then coming out without having these diseases?
It can be solved by, first of all, letting the mothers understand the importance of antenatal care. So it starts pretty much before the baby is born. Antenatal care. Mothers should be made to go for antenatal care, okay? Take their drugs, do the investigations they're asked to do, take their routine medications, and if they have any problem, they go to hospital on time. And they should go to a hospital where you have capable hands to take care of those babies when they are born, okay? The problem is not only for the parents, even the healthcare professionals. Like if a mother goes for antenatal and the healthcare professional, maybe traditional health birth attendant, for instance, or a nurse in a maternity home, notices that there's a problem with the baby, this is beyond what I can handle. That person should refer that woman with the baby in utero on time to a facility where they have hands, expertise to take care of both the mother and the baby. Okay, we have situations where a woman is in labor in a facility for days, and the mother is tired, the baby is tired. At the end, they might refer the mother eventually when everything is spoiled, already spoiled. Do you understand? When this baby comes out, the baby becomes asphyxiated, and you don't expect anybody to do any magic. We may try, we may eventually save that baby, but that baby may never go to primary school. So you see, it's a very huge problem. So referrals, the parents should first of all seek antenatal care, go to a facility where you have an experienced person, a trained person to take care of that baby. It mustn't be a doctor, okay? It can be somebody who's already trained to take care of the mother and do the necessary things that we should do during pregnancy. And then when this person notices that this is beyond what I can handle, he should refer the mother with the baby on time.
You know, you said something that got me, and you said by the time things are done, there is almost nothing that can be done after the mom has been in labor for a long time. And then even if the child is managed, they have managed to be able to get this child, the child cannot go to primary school. What causes that? So meaning like there is like a brain damage or something?
It's the asphyxia we are talking about. In the neonatal period, there are many things that can cause asphyxia. This perinatal not being able to transit smoothly to the world outside the womb, life outside the womb, is one of the causes, okay, that can cause the brain damage. There are other things, bilirubin problem, that is jaundice.
In fact, I was going to speak about jaundice because those are one of the major issues I see, like newborns have.
Yes, it's a very big problem. It can easily be prevented. It can easily be prevented. It's just creating awareness and letting the people, you know, the healthcare professionals know exactly what to do, okay? Putting policies on ground to identify babies with jaundice and manage them appropriately. They can easily be prevented, okay? But because people are not aware, and maybe babies are born and kept in facilities where they don't have the facility to manage, wherewithal to manage these babies. You see, things get out of hand, and these babies come with brain damage.
But what about cases where it almost seems like everything was seamless, there was no problem, and the child still has jaundice? Because I know one of the things they say when the child has jaundice, dry him under the sun for the child to take.
No, many babies have jaundice. Jaundice is caused by, there are different types of jaundice. You can have what we call physiologic jaundice, you have pathologic jaundice. Many babies can come down with jaundice, but it depends on the level. It depends on the cause. It depends on how it's managed. Do you understand? For a baby to have jaundice is not a taboo. Their metabolism is not mature, liver is not mature, conjugation system is not mature, so they can come down with jaundice, okay? But when they have the jaundice, the steps that the parents take matter a lot. The steps that the healthcare professional that sees this child with jaundice, the steps that the person take matters a lot, okay? Jaundice can be prevented, can be handled, can be treated, can be treated very well. Many babies can have jaundice, but many of them have what we call physiologic jaundice.
Now, there is this thing, when the mother gives birth to a child, they try to just cover up the child and just keep the child, don't expose the child.
See, that's a problem. Do you understand? It's a problem. They close up the child, they close the windows, they close the blinds, everywhere is covered up, that cold will not enter the body. They believe that if you expose, if any small breeze, it blows on the baby will have pneumonia. I don't know where we're getting all these things from. It's misinformation, okay? And we as healthcare providers have a very important role to play, okay, to correct all these impressions that people have. And when a baby has jaundice and they wrap up baby like that, they will not be able to identify anything. Do you understand? The only thing they will not notice is that this baby is not sucking as the baby used to suck, baby is too dull, baby is not, and then the baby is now very yellow. By that time, when they come to the hospital, brain damage is already ongoing. But if by the moment, maybe second day or third day of physiology into the jaundice, they notice the jaundice, the yellowish discoloration of the skin or eyes, and they come to the hospital immediately, appropriate thing will be done. Baby will be put under what we call phototherapy, or depending on the cause of the jaundice, baby will be treated, and everybody smiles home. Okay.
Well, I'd like us to move on with this conversation. We'll talk about the roles of parents, what they can do, and then things that can actually be like policies and things that can actually be done to make sure that the rate of neonatal mortality in Nigeria is really, really reduced, because that is like one of the major, like you said earlier, one of the major causes of newborn deaths. But that will be when we come back from this short break. So we're going to go on a short break, and when we return, our discussion will continue. Just stay with us.
Following the sudden outbreak of cholera in some parts of the Federal Capital Territory, significant number of cases have been tested positive for cholera. The Health and Human Services Secretariat has intensified surveillance in the affected communities around the area council. Therefore, residents are requested to report any case of diarrhea to the nearest health facility or the Department of Public Health on the following numbers: Dr. Sadiq Abdurrahman, 0803-705-1784, or Dr. Doris John, 0803-315-6560. Ensure that the water used for domestic purpose is clean, boiled and filtered. Start ORS immediately you have diarrhea. Ensure that all food is properly cleaned and well cooked before consumption. Ensure that fecal waste are hygienically disposed of. Do not defecate in the open or into streams. Houses with surface wells should make sure they are covered all the time. Public Health Department, FCT Health and Human Services Secretariat. Announcer.
Welcome back, and thank you for staying with us. Before we went on the break, we've been having a discussion on neonatal diseases, and Dr. Bessie Ezechila, who is a pediatrician and neonatologist, is here and discussing this and opening our eyes to how we can take care of newborn children. So before we went on the break, I said we're going to talk about the role of parents in making sure that neonatal diseases are prevented, and even if there are neonatal diseases, what can be done to treat them. So basically, one of the things, I'm not a mother anyways, but one of the things I've heard is whatever the mother eats actually affects the child. I'd like you to expand more on that for us.
Well, if a mother feeds well, the mother will be able to lactate, okay, at birth, even before delivery. The pregnant woman should feed well because she's feeding for two. She needs nutrients, she needs vitamins, she needs iron, so many things to take care of to make sure that, because baby feeds from her actually through the placenta. Okay, so this mother needs to feed well. All right, it mustn't be one rich person to feed. We have locally available foods. We have supplementation, multivit and folic acid that the mother is given during antenatal care. That's why I'm emphasizing on the importance of antenatal care. Okay, the mother feeds well, and then when the baby is born, the mother should breastfeed. Recently we celebrated the word breastfeeding. That's the emphasis. God has given us something freely. We should lay as foundation for all these babies. Do you understand? Even if the mother does not have money, the parents do not have money, the breast milk is there for the first 6 months of life. So if the mother feeds well, is hydrated well, she should breastfeed her baby. And these people will get all the nutrients, the first immunization, everything that is God has prepared. That's natural food prepared by God for newborn humans.
Now, talking about policies and programs that can be put in place, most especially to checkmate, like you said earlier, when children have joined this, most times parents don't recognize till it's already way past almost a situation that can be salvaged. What policies or what programs can be put in place to make sure that neonatal diseases are really actually taken care of?
Well, before now you had asked question on the role of parents. I have emphasized that parents should get to the facility first. The healthcare professional will not go to their houses, especially in this current Nigeria, you not go to their houses to be bringing out babies. It's the parents that will notice that there is a problem. We need to visit the facility, and they take themselves with the babies to the hospital. Now, policies are different levels. We have policy at the healthcare facility level. Like in our hospital, when a child is born, and we discharge we evaluate the baby, and then we think that the baby is fine, maybe discharge after a day or so, depending on the mode of delivery. We usually ask the parents to bring back the baby, maybe on the 3rd day of life or thereabout, for every evaluation to make sure there's no jaundice. Okay? And it's important at different health facilities to counsel these parents, let them know the signs of ill health, that if they notice in the babies, they should immediately get back to the hospital. Okay, so these are very important. Policies are also, we have policies at the government level. Government has a lot of role to play. Okay, I belong to Pediatric Association of Nigeria, and I know they are doing a lot with NISOM, okay, Nigeria Society for Neonatal Medicine. They are working a lot with the government to roll out policies to check all these causes of neonatal mortality. They have policies to check neonatal sepsis, okay, and one of them is cord care. Many people don't know how to care for the cord, and it's a very important route of infection to the babies. When a baby is born, that cord that is remaining, umbilical cord. Nowadays, before it was methylated spirit we are using, but nowadays we have chlorhexidine gel. You're going to be a mother soon, so you'll see.
I learned.
Okay, so we have chlorhexidine gel, which we apply on the cord. So mothers this was rolled out by the Federal Ministry of Health together with Pediatric Association of Nigeria, World Health Organization, World Health Organization thing even. Do you understand? And those adopted by our Federal Ministry of Health and Pediatric Association of Nigeria. So when the cord is properly cared for, the chances of infection for the baby is reduced. The other policies, like kangaroo mother care for premature babies. Have you heard about that before?
No, but I think of the name I should
From kangaroo, carrying a baby in the pouch. Yes,
yeah.
as little as, but in that pouch, with time, the baby grows. So we adopt that strategy for our newborns, okay? And it's been helping a lot because we don't have a lot of incubators at our disposal. So that has been helping a lot, even in the interior of the villages, okay? Other ones, we have every newborn action plan, prevention of perinatal and maternal mortality. These are strategies and things that the government is doing with UNICEF, WHO, our NISOM, and Pediatric Association of Nigeria, all get towards reducing neonatal mortality because it's a lot. We should run along. Other countries have very, like in developed countries, very low infant mortality and neonatal mortality rates, but our own is still very high. Okay?
Yes. Now, there was something you said earlier and, concerning being able to, the child, when the child is born. And like I said, one of the things I know from being able to visit someone, being able to help others when they give birth to babies is the covering. And you said it's not always very necessary to cover the child. I'd like you to explain, because I feel the rationale behind them covering the child is, the child is just coming from the womb, so the child has not acclimatized to the world. So, okay, just cover the child, let the child have a feeling like, okay, he's still in the womb before he gets...
No, when a baby is born, we usually provide a, warm environment, where baby... That's why when a baby is born, if it's normal delivery, baby is placed on mother's skin, to provide warmth for the baby. But thereafter, after baby has transited smoothly, and the baby is breastfeeding and all that, we should not cover so much so that we'll be able to detect some of these illnesses when they are there. Do you understand? If a baby is pale, maybe the blood level is low, and you wrap so much, you'll not be able to see. If a baby is jaundiced, you'll not be able, if a baby is cyanosed, the color is bluish, maybe due to inadequate oxygen, but you'll not be able to see. So there's no point covering. If you are hot, then the baby is likely to be hot, unless it's a premature baby. It's only premature babies that will do that kangaroo mother care to provide extra warmth because they don't have enough fat, But an average baby that is term has enough fat, okay, to act like as an insulator. So don't need to cover all that much. It's not needed.
Well, there's something I want us to actually talk on as well, other diseases. like talking about malaria for small children, and that's like one of the major causes of neonatal mortalities. Basically, because even for us as adults who are not even done with dealing with malaria, and then for a small child to now come down with malaria, what can be done about that?
Infections in the neonatal period, one of them is malaria, and the newborn can get malaria from the mother. Okay, and that's why one of the things that government is also doing is to make sure that mothers sleep, pregnant women sleep under insecticide-treated net. I don't know how many of them do that. Rather, they use it for some other purposes. But every pregnant woman should sleep under insecticide-treated net, okay, to prevent the baby eventually, to prevent malaria in the woman in the first place, which can cause preterm birth, okay, and then prevent the baby from getting malaria when born. Okay, another thing they do is they give them prophylaxis. Okay, so why is many of them towards the mothers? Okay. They give them prophylaxis to prevent them malaria in the mothers and consequently in the babies. Okay, so these are very important strategies that the government has adopted to prevent malaria, for instance, in the baby when born.
Well, thank you very much, Dr. Ezekiel, for taking our time to be here with us. But before we wrap up on the program, I'd like you to give a word of advice to new mothers that are still trying to find their way around being able to take care of their babies, because most times they actually do need the advice. Most of them don't necessarily know so much, so it just depends on older people that have been there, and some of the things are so archaic and also straightforward. So I'd like you to give a word of
honestly, that is a big problem. You should not play with the advice from your healthcare provider, not the grandma and grandpa in the village. They mean well, but they do not really understand. It's ignorance. Like somebody will say, why are you giving your baby? A grandma will tell the young mother, why are you giving baby only breast milk? I gave you water when I had you. Why are you not giving water?
I did do that a lot.
But that is not correct, because we know that breast milk contains enough water for the baby. Okay, so they should get information from the right source. I think that is it. And do exactly what they are told to do. Because all this information from here and there, they are the cause of the problem. And if they have any problem, they think that the baby has any problem, you should get to the hospital. Even when the baby does not have any problem, occasionally, when they go for immunization, they should not joke with things like immunization. It's very important. It starts from birth. And when they are coming regularly for the immunization, if there's any problem, an intelligent healthcare professional will be able to know whether it's a CHIO or a nurse or a doctor, identify the problem, and it will be treated accordingly.
Well, thank you very much, Doctor, for taking our time to be here, and we sincerely appreciate your presence here. We do hope when we come up with other topics that have to do with neonatal disorders, you'll still take our time to discuss this extensively with us.
It will be my pleasure.
Thank you very much.
You're welcome. Thank you.
Well, that's the size of our package today on health and well-being. Do keep it a date with us. Same time next week. I am Lois Apasambo. Do stay safe.